Welcome back to the Wellness Abundance Podcast. I am so excited to have my guest, Dr. Katie from the Pelvic Practice here in Thousand Oaks with me. So, welcome, Katie.
To be here.
Yeah, I'm excited that we were able to connect and have this great conversation. So, I'm going to let you, Dr. Katie, do an introduction of yourself, who you are, maybe a little bit about your practice, your background, whatever you'd like to share with us.
Yeah. So my name is Katie Hunter. I am a doctor of physical therapy. I specialize in treating pelvic health, pelvic floor dysfunctions in particular. And as you've already mentioned, my practice is in Thousand Oaks, California. My background is, attending physical therapy school, learning about pelvic health, and then going into the specialty as a student and starting actually out in Orange County, moving my work up into LA, and then eventually back to Ventura County because I am from Camarillo. So I knew I wanted to come back and settle down out here. I've been working with all genders since the beginning of my career, and I continue to work with both female and male anatomy.
Cool. That's great.
Yeah.
I love it.
Yeah.
So when Dr. Katie and I were talking about like what we should talk about during this conversation, I work primarily with perimenopausal and menopausal women and even postmenopausal women. So we thought it would be fitting to kind of talk about the lifespan of the pelvic floor, which works out really well because this is Dr. Katie's expertise. So I'm just going to let you start wherever you'd like to start about the lifespan of the pelvic floor.
Yeah. So the pelvic floor muscles, most people are familiar with them or know them as the Kegel muscle. They are the muscles that you use to perform a Kegel exercise. They are also the muscles that you would contract if you're trying to stop gas from passing or trying to stop the flow of urine. For the purposes of our conversation and knowing your audience, we'll definitely tailor this conversation more to women's health. And in talking about the lifespan, I'll go through expected pelvic floor development and some roadblocks people might run into throughout their lives. So the pelvic floor really, I apologize, I don't have my model with me of the pelvis. It's in the clinic. I'm not in the clinic right now. But the pelvic floor muscles sit in our like saddle region. So if the part you're sitting on, if you looked at it with a mirror, you're going to see the external genitalia, but the pelvic floor muscles are just underneath that skin and those structures. It spans from the pubic bone back to the tailbone and in between our sit bones. And like I mentioned, it closes the openings so that you don't leak or lose control. It supports the organs that sit inside of the pelvis. And then we actually use those muscles to start the process of emptying the bladder and the bowels. And then the pelvic floor also plays an important role in sexual function in regards to any penetration, stimulation, and orgasm. So that's its normal function. Most of what the pelvic floor muscles do is reflexive. So we don't think about using our pelvic floor. It happens on its own. But it is muscle, just like the muscle in our arms and legs. So I tell people it functions in the same way as the diaphragm, which controls our breathing. As we're walking and talking, we don't think about breathing. But if someone told you to breathe in, you can do that. If they told you to breathe out, you can do that. Same thing with the pelvic floor. We don't think about using our pelvic floors, but if you wanted to contract or perform a Kegel, you can do that. If you want to relax, which I call a pelvic floor drop, you can do that. So that being said, when it comes to development of the pelvic floor in childhood and adolescence, it's really just, we focus on bladder and bowel control. And that helps develop normal reflexes of the pelvic floor muscles. And there are exceptions to what could interfere with normal development. A lot of it is neurological diseases, but something I like to touch on because it is something I treat quite a bit of, and that is anything that causes a pelvic pain situation, and the most common in my practice being endometriosis.
Mm.
So that's something that will come up in puberty for young girls, and same goes for PCOS. Things that disrupt normal hormone function and then bladder and bowel function.
Yeah, I'm glad I was actually thinking of PCOS too when you mentioned endometriosis. And it's interesting because I grew up in the 80s and 90s, and I was not educated on the pelvic floor. It wasn't until within the last, even 5 years that I really started studying um, women's health that I actually learned what the pelvic floor does. I knew it was there, but I didn't know what its purpose was, with how it's reflexive, and I didn't know any of that. So, and I'm so grateful that, there are experts like yourself out there, because we as women, I think when girls start menstruating, this is when they should really be educated on their bodies to pay
Absolutely.
attention to abnormalities like pelvic pain, because it's not, when I grew up, it was just like normal. Like it's just
Right.
something that happened and you just dealt with it. And
Absolutely.
now we're much more aware and more educated. So yeah.
Yeah, absolutely. And I bring that up just because that is a place in life where there could be a disruption of normal muscle function and development that then a person carries on through the later stages of their life. And a lot of people have never even heard of endometriosis and PCOS. But the two big life events in a woman's life that really impact the pelvic floor muscles are pregnancy and menopause. So those are the two times where most people start to learn, if they do at all, start to learn about their pelvic floor muscles. Absolutely, I agree with you. It should be coming up in conversation in puberty, especially to help people identify when things aren't functioning correctly or things are going wrong. But definitely during pregnancy and then later menopause is when people end up in the clinic to see me.
Yeah.
Yeah. So I'm happy to talk about the changes that occur there in pregnancy. I'll try to be brief about it because a lot goes on.
Yeah.
during,
Oh, yeah. Oh my
yeah,
gosh. I can only imagine. I personally have never been pregnant, so I don't personally have any physical experience with it. So,
yeah,
but I am definitely super curious because most of my
yeah,
clients
yeah,
have given birth. So this is actually
yeah.
really good information for me to know.
Yes, I mean, so you're exactly right that it really is the delivery process that changes their muscle function. But there are things, postural changes that go on during pregnancy and how our center of gravity changes with the big belly, where you already start to move and use your body differently in pregnancy. And that goes on for many months. And then you go through a major event and change in your body, and that is delivery. So if you have a vaginal delivery, the pelvic floor muscles have to stretch greatly to allow for a baby to come out. And the muscles need time then to recover after that great big stretch. Same thing with the abdominal muscles after a C-section. In that case, there's an incision and an opening of the abdominal muscular wall that the person needs to recover from. With the pelvic floor after vaginal delivery, there's also, if a person had a tear, which is extremely common, it's like 90% of people who deliver are going to have some degree of tearing. And there's 4 degrees of tearing, but a 3rd and 4th degree tear involves muscle. So those people in particular really need to take the time to rest their body after having a tear like that. And I tell, most of the time I end up having this conversation after the fact, but I tell people that they really, it's a muscle tear. It's a muscle injury. So they really need to be taking the full 6-week recovery time and listening to the symptoms that they're feeling after, which is not always an option when they're taking care of a newborn. So then you have C-section deliveries, and those people tend to be naturally more limited in what they can do because there's a visible scar or healing incision there, and an oftentimes painful incision that prevents them from moving in the same way. So important things to note after any delivery. In most cases, the symptoms, it's very common to have some degree of symptoms that could be leaking, heaviness, pressure in the pelvis, pain, difficulty with bowel movements, difficulty emptying their bladders, for the first 3 months postpartum. As time goes on, you should see those symptoms gradually get better. But research has shown that if symptoms are persisting after 3 months postpartum, they are much less likely to go away on their own in a person's lifespan. So you'll see women who say, I've been leaking since I had my kids, and they're in their 50s and 60s. So that's, 30 years that they've gone their lives leaking and kind of assuming that's normal because they had kids, but it's not.
Yeah. And this is why I feel like it's so important to have these conversations, because we just, we just think everything
It's normal.
is normal. All
Yeah.
these pains and the leaking while you're just walking,
Yeah.
going about your daily life, or even like doing squats.
Yeah.
Shouldn't
Absolutely,
be
with exercise.
any leaking during any type of exercise. So
No, exactly. Right. So I share that, and I usually will advise people if you're beyond 3 months postpartum and you're still having symptoms, then it's most likely not going to go away on its own, and it's time to seek physical therapy, where we do rehab in retraining the core muscles, including the pelvic floor, how to work again after having a baby. But the good news is it's muscle, and we can make changes on muscle in a way that we can on other parts of our body. So there's a lot you can do. It's just about learning how to use your body correctly.
yeah. And this is actually a question that just popped into my head. Do you talk about like nutrition, like the importance of protein? Like I'm assuming you do, but
I absolutely do. In my role, the big conversation around nutrition has to do with bowel movements, because constipation, it affects the function of the pelvic floor. So if a person suffers from constipation, even like regular diarrhea or pain and bleeding with bowel movements, then the muscles are going to function differently. And there's a big correlation between constipation and leaking. So I talk a lot, probably more about the importance of fiber and water in the diet, and a little less about protein in regards to muscle function, for no reason other than I'm just so focused on bowel function at that point.
yeah,
Yeah.
that makes sense to me.
Yeah.
That makes total sense to me. We need the fiber and the hydration, to
Exactly.
to be regular, right?
Yeah,
Yeah.
absolutely. The other conversation I have a lot that just talking about like nutrition and what feeds our pelvic floor is hormones. So much conversation about hormones, which kind of leads into the perimenopause menopause situation, where pregnancy, if a person is pregnant or has a baby, symptoms may arise at that point and last up until a point the person goes through menopause, but it might come and go throughout that time of their lives between 20s and 50. The symptoms may come and go just depending on what's going on in their life. Around menopause is when symptoms will return, if they ever resolve, or a woman will notice that they get worse in menopause. And the reason is because the pelvic floor actually has estrogen receptors. So thinking about how your thought process was how important protein is for muscle development and recovery after an injury, it's actually estrogen that the pelvic floor muscles thrive on and really need.
Oh, okay. Yeah, I know. It's so fascinating to me, like the whole which hormones, factor into what
Yeah.
functions and systems
Yeah.
and how they operate in our body. And this, the last couple of years, I've done a really super deep dive into women's hormones. I'm specifically right now really studying menopause. But yeah, it amazed me. It amazes me how many estrogen receptors we have just
In
throughout
our
our
whole
body.
body.
Yes.
Yep.
They're like everywhere.
Yes.
People talk about, like, oh, you need to get your progesterone up and maybe even your testosterone. And yeah, estrogen drops, but maybe there's not much you could do about it. But estrogen is probably the most important one to
Our
um,
overall health.
for overall. Yeah.
Yeah, absolutely. And I've heard, I haven't personally read research about the importance of estrogen in brain function, and how in menopause the brain will actually increase the number of estrogen receptors it has, because it's trying to get as much estrogen as it can with as little as the body is producing. And at this point, I think just because of the life expectancy of the average person, people are living 20 plus years in a menopausal state, in an estrogen deficient state. And really the expectation is if you don't have enough estrogen in your body, it's going to decline. That is just a fact. And there's only so much that we can do to try to maximize the amount of estrogen we're making on our own.
Yeah. Yeah. It's tricky too, because, one thing that I've learned in my research, which kind of explains the mid belly weight gain, like,
Mm-hmm.
or in your 40s and even on into your 50s, is that adipose tissue makes estrogen.
Yep.
And that's a lot of the reason why your body,
Wants to
you
hold
know,
on to it.
wants to hold on to it, which it's like, yes, maybe it doesn't look the best, aesthetically.
Yeah.
And maybe if you've never had that belly fat before, it's like, well, now I feel very uncomfortable and self-conscious about this. On one hand,
Totally.
on the other hand, it's like, well, this is my body's way of, um, you
Adapting.
know, yeah, boosting estrogen. And I always tell people, my clients and, everywhere I can in all my content, like, your body knows exactly what to do to keep it thriving. You just need to fuel it and, fuel it properly, hydrate it, move it frequently, give it proper rest, and it knows what to do.
100%. Yeah, no, I think it's really incredible that our body adapts in that way to try to um, give us what we need. So it's not all bad, even though we don't want it there. We don't like the look of it. It's not bad. When it comes to my specialty with hormones and menopause, something that the biggest piece of advice that I can give to women is not being afraid to supplement with hormones. And if there is a fear of systemic hormones for various reasons, or the doctor or provider they're seeing is not comfortable with it, at the very least, they can be using local hormones, particularly vaginal estrogen. But there is also vaginal DHEA and vaginal testosterone if the provider is comfortable prescribing that, because the entire vulva of the female genitalia, so we're talking labia, the clitoris, the clitoral hood, the vestibule, which is the tissue that makes up the opening, and the vaginal walls, all require estrogen to have good moisture, to have good blood flow, good tissue integrity. And without that estrogen, the tissue is going to dry and shrink, and which is also called atrophy. It's going to shrink and kind of shrivel up and become fragile, and it changes the pH of the vagina, so it makes you more susceptible to infections, which really could become life-threatening later in life. So don't be afraid of vaginal hormones. Ask your doctor about them. get them. And then there's also no shame in supplementing systemically as well.
Yeah. Yeah. I mean, but I personally don't need to take hormones at this point, but if I ever needed to down the road, wouldn't, I
Yeah.
wouldn't hesitate,
Yeah.
and I would totally do it.
Yep. 100% me too. I mean, now, the biggest fear of everyone's is getting cancer.
Mhm.
Everyone thinks if I use hormones, I'm going to get cancer, which is just absolutely not true. And I always remind people um, about how, what is the word I want to use? Quick, I guess we are to take something like hormonal birth control, which is the same hormones that are taken in menopause. So not the same dosage, but the same type of hormones. And we're feeding that to young women for all sorts of reasons. And it really is overall to feel your best self. So why not do that in menopause as well? And now there's research coming out that, or there has been research that it benefits bone health, muscle health,
Mm.
brain health, um, heart health to actually take the hormones. So yeah.
Yeah, and to me, that makes like total sense because that's what those hormones are meant to do. They're meant to protect your heart. They're meant to protect your bones. You know, they're meant to do all those things. And
Right.
did see something within the last couple months that the FDA is removing the severe warning signs on hormone replacement therapy.
I have not seen that. That's
Yes.
incredible.
It's amazing. It's absolutely something to be celebrated for
Yeah,
women, I think, because it kind of, like you mentioned, just a few minutes ago, one of the biggest fears is cancer,
absolutely.
as a side effect for taking these hormones. But they found that those studies 20 years ago were flawed. And
Hmm.
this practitioner friend of mine who prescribes hormone replacement therapy actually told me, no, Melissa,
Hmm.
that's not true. Those studies
Right.
were incredibly flawed. And so that's something really exciting.
Yeah.
And one thing, if you find a really good doctor, they should be able to educate it enough to help you kind of cycle the hormones, like
Hmm.
only take them during the times of the month when you're specifically low, you
Mm.
know, when you're having a dip
Yeah.
in that for a week or two or however.
Yeah. And you mean in perimenopause?
And yeah, and menopause.
Okay.
So that's also a big thing right now too, is really, I mean, you have to track your hormones,
Yeah. Right.
to know where they are. But yeah, a really good physician, in my opinion, will really work with you closely and really personalize your
Yeah.
hormonal
Yeah.
dosage.
Yeah. Absolutely. Yeah. No, I'm so happy to hear that. I know there have been people that have been trying to get that black box label off of at the very least local hormones forever because it absolutely does not increase the risk of cancer. And it's really doing women a disservice to have it on there.
Yeah.
So
Yeah.
amazing.
I know, and it's interesting. It's something really really great to celebrate, not just because it's actually happening, but because it's actually happening. Because it's the FDA. They're so slow
Hmm.
to make changes,
Yeah.
and on one hand, I get it. They want to keep everyone safe.
Right.
On the other hand, it's like, well, let's speed up the process a little bit. So
Yeah.
but anyway, that's another topic.
Yeah. No, that's very exciting. So yeah, I also recommend starting the conversation early with your provider about using local hormones or any hormones, even in perimenopause, because that's when those changes start to occur in the field that I treat in, specifically talking about vulvovaginal health. We start to see those changes around 45. where the vaginal tissues start to become slightly less lubricated. They start to atrophy a bit. And unfortunately, because so many people have been on some type of hormone suppression in their life, meaning hormonal birth control, but also acne treatments that suppress hormones, medications for something like PCOS, they may even be experiencing that type of atrophy earlier in their lifetime, in their 20s or younger.
Okay. That's
Yeah.
interesting. I didn't think about that. That's
Yeah.
good.
It's something I treat quite a bit because one of the, in the menopause category, there's something called the genitourinary syndrome of menopause, GSM. It's one of the symptoms of menopause, where a person will experience painful sex, urinary urgency and frequency, UTI-like symptoms, and the cause of it is the depletion of estrogen and testosterone. And so we will see those same symptoms in women who are using hormone suppression in their 20s or younger. Yeah. Yeah.
Goodness. Oh, that's
I
interesting.
know. A lot to think about. So I've seen a number of people who have all of the same signs of vaginal atrophy and pain and symptoms. And then as they age and get into their 40s, it's like they're already starting in a depleted state and their estrogen continues to drop, and they will see vaginal atrophy sooner than someone who may not have had that same suppression.
Oh my gosh. I'm so happy you shared that.
Yeah.
Oh my gosh, that's so good. Because I do, unfortunately, a lot of the women I speak with have challenges like endometriosis
Mhm.
or, managing PCOS, something.
Right. And it's not, the conversation I have is that it's not worth going off of those medications if they're really working and helping to manage the disease process. But they could be using local hormones at the same time. So, and that's something that is often prescribed with the providers that I work with, that they'll stay on their hormonal birth control or whatever medication is helping to treat the other symptom, while using a local vaginal estrogen, vaginal testosterone, or DHEA to feed the vaginal tissues to protect that and to help with painless sex and leaking and urgency frequency, but still manage the other symptoms.
Mm.
Yeah.
Good. Oh my gosh. This is so great. I'm learning so much from you. Thank
Good.
you.
I'm so glad.
Yeah. So what else would you like to share about the pelvic floor and perimenopause or into menopause, postmenopause, anything?
As a physical therapist, I would be disappointing myself and others if we didn't talk about exercise.
Yes. Oh my God.
Really.
I agree. So let's do it.
Oh, uh, so yes, I know that you were interested in learning more about the right exercises to do for the pelvic floor or for pelvic health. And I should go over first other symptoms of pelvic floor dysfunction so that people know what I mean when then I start to talk about symptoms. So really common symptoms of pelvic floor dysfunction would be leaking, urinary urgency and frequency, difficulty emptying your bladder, particularly with exercise and high level athletes, along with leaking, they might experience pelvic pressure, pain, sharp pains, achy pains into the genitals, around the pelvis, around the hips, around the back. And then bowel symptoms could include difficulty with elimination and bowel movements, incomplete emptying, the need to frequently wipe, pain, bleeding, hemorrhoids, things like that. And then with sexual function, a big one, painful sex, painful orgasm, painful penetration, both with insertion and or deeper penetration. And I treat men as well. I mentioned that. So that can also impact arousal, erections, ejaculation, that kind of thing. And just in case there are any men listening or women who know men. So those are the symptoms, which the number one symptom, the most common symptom is leaking, particularly in menopausal women. So that is where I'll kind of start the conversation, but know that this does not apply to everyone, especially people who may experience pain with leaking, because there is a misconception with leaking that it means my muscles are lax and loose and I just need to do a bunch of Kegels and I will stop leaking. Yeah, and that is not true. A majority of the people who end up in the clinic who see me have high, it's called hypertonic pelvic floor or high tone in the pelvic floor muscles, which means that the muscles are tight, short, and almost like they're stuck in a contracted state. And so in that case, you don't want to do a bunch of Kegels because you're already stuck in a contraction. We really need to learn how to let go of the pelvic floor. Yeah. So general exercise tips that benefit the pelvic floor are not really targeted pelvic floor muscle exercises. It's actually regular weight bearing and resistance training that involves the muscles in the whole body, but especially the legs. So yeah, as long as you are symptom free, no leaking, no pain, then walking is one of the best exercises to help keep a strong pelvic floor. And after that, resistance training that involves strengthening the leg muscles. So the whole thigh, quads, inner thigh muscles, hamstrings, glutes are a big one. And then core exercise, because the pelvic floor is part of the core. But I prefer, as a PT, I like stability exercise over something like crunches and bicycles. So if people are familiar with dead bugs, bird dogs, and plank progressions, those are my preferred core exercises.
Yeah. Cool. We do. I teach a group fitness class.
Oh, nice.
As part of a local corporate wellness program for a company in Newbury Park, and we do dead bugs. And we're like, is this more like mobility? I'm like, you're gonna feel it in the core.
Yeah.
You know, the dead bugs are amazing.
Yeah.
They are my go-to core movement lying on the floor. If like it's because it's not that difficult to do. It doesn't really work your muscles too much, and it's easy on your low back too.
Yeah. It's good for the back.
Yeah.
Yeah, that's so great. Yeah, all those stability exercises, that's where that's our foundation for movement. So, and they're surprisingly harder than upright exercise for people. So they are meant to challenge the core muscles, and it's very difficult to cheat when you're doing them. Whereas we find ways to cheat with squats and lunges and overhead presses, things like that.
Oh yeah, I'm always keeping an eye on everyone.
Yeah.
With those and correcting myself included.
Yeah.
Oh my gosh, I was doing some overhead presses this morning at the gym, and I was like, I had to keep like my form because I can get a little lax on my form as well.
Oh yeah, we all do it.
Yeah. Yeah. So
Yeah. So those are general, exercises that do benefit the pelvic floor as long as you are not symptomatic while you're doing them. I don't really give a prescription for specific pelvic floor exercises because everyone's different. And it really depends if you need them at all. And that's the other thing is the pelvic floor is reflexive. We're using it all day long. If anything, the pelvic floor needs rest. That's what people need to be giving it. So, I've known people, I've talked to people who are just do their Kegels. They do their Kegels because their mom or their aunt or their sister told them to do Kegels every day to have a strong pelvic floor, to have a good sex life, whatever it is. And It's not true. You do not need to be doing Kegels as long as you are not experiencing symptoms. So if anyone ever asks me what's the best exercise for the pelvic floor or a specific exercise for the pelvic floor, I give them breathing.
Oh, yeah. Can you, I was going to ask you about that.
Mm-hmm.
Can you elaborate on that a little bit?
Yeah, absolutely. So when I say breathing, most of the time I'm talking about diaphragmatic breathing, which is breathing primarily with the diaphragm muscle. The diaphragm sits under the rib cage. So it's a dome-shaped muscle that when you inhale, it flattens, the ribs come out and away from the body. And then as you exhale, the diaphragm lifts back up inside the rib cage. The pelvic floor mirrors the diaphragm because the pelvic floor is a bowl-shaped muscle. So when the diaphragm flattens, the pelvic floor should drop and lengthen. When the diaphragm lifts back up, the pelvic floor should lift back up. And so we get this like nice kind of flow within the body that helps with blood flow. It helps with digestion. It helps to give the organs inside the abdomen and the pelvis room to move and kind of breathe on their own. So the way to do diaphragmatic breathing, you can do this in any position. The easiest position actually is on your side. So for someone with a very weak diaphragm, and most people don't know that they have a weak diaphragm, but if you are a chest breather, if you take rapid, shallow breaths up into the chest and through your neck and shoulders, then you probably have a pretty weak diaphragm. If your rib cage does not move, you probably have a pretty weak diaphragm. The easiest position to start this is laying down on your side. And then you would move to breathing on your back. You could move into breathing on hands and knees from there, and then into sitting, and then into standing. And the focus is as you inhale, you're softening your belly, softening around the pubic bone, and imagining your rib cage is expanding on all sides, side to side, front wall, back wall, expanding out and away from you as you take an inhale. And then as you exhale, the rib cage comes back in.
Wow.
That's a lot of information.
Yeah, no, that's great. I loved the way that you described it in a very simple way to understand. So
Okay.
I appreciate that. Thank you.
Yeah. And
Yeah.
I'm going to add one more thing. Sorry, that as you breathe this way, you're opening and lengthening your pelvic floor. So that's why I give breathing as an exercise for the pelvic floor, because most people do know how to do a Kegel, but most people do not know how to do a drop or relax their pelvic floor. And the pelvic floor is a very common muscle to hold tension and stress in.
Yes.
So most people have a lot of tension in their pelvic floor muscles.
Yes, I have read that and noticed that with myself.
Most people do.
Yeah. So I'm so happy you brought up breathing because I feel like breathing is the low-hanging fruit that
Absolutely.
most people don't think about. Like people, when they come to me for, help with putting together a fitness routine, it's mostly because they just don't really know, first of all, how to program a workout, which movements to do, but also how to make sure they're doing it safely with proper form. And breathing is always something I talk about.
Yeah. First thing.
It should be the first thing. I see people at the gym all the time, like holding their breath
Yeah.
through movements. And I'm like ready to like, okay, am I going to need to do CPR? Is this guy going to pass out in like a minute, from holding his breath?
Yeah.
I mean, women do it too in the gym, but men, I noticed men doing it more. But yeah, really kind of getting that breath,
Absolutely.
and
yeah. And you start it at rest. Start it when you're quiet, when you're still, your body's not moving. Then you progress to movement and exercise. It is absolutely, it's better to breathe while you're exercising than to hold your breath. But we can't expect to be good at breathing with movement if you can't even breathe while you're still.
Yeah. Yeah. I love that. Yeah. So great. Well, is there anything else you'd like to share before we wrap up?
I can't think of anything. Yeah, I think we really covered all the things with wellness. We didn't go over good bladder and bowel habits, but hopefully people have a good idea of what good bladder and bowel habits are. But that is the other place I would start with if anyone asked me what is good for a healthy pelvic floor. I would say look at your bladder and bowel habits, make sure that those functions are normal. Because if they are not normal, it's going to disrupt your pelvic floor reflexes, and then you can do all the exercise in the world, and your pelvic floor is still going to be disrupted every single day when you're doing those things.
Okay. Yeah.
Yeah. So
Good to know.
bladder, bowel health, sexual health, of course, and then exercise. We
Yeah.
covered. I think we covered it all.
Yeah, I think we did great in this short period of time we have together. So thank you so much, Dr. Katie, for your time. I will post your website in the show notes, and
Yeah.
anything else you'd like me to, we could chat about that.
Perfect.
You know, after we sign off. But this was really educational, and I'm really grateful that you were able to carve out some time in your busy schedule to talk with me. And yeah,
Oh, so happy to do it. I love spreading the word about pelvic health and the pelvic floor. And yes, please, everyone go tell your friends, your family, you have a pelvic floor. It's really important. Take care of it.
yes, yes, please do, please do. And then, I'd also love to have you back on again, because there's so many things we could talk about with pelvic floor health.
Yeah, I
I
would love
feel
it.
like we really just scratched the surface today. So
Yeah, absolutely. I would love it. Thank you.
awesome. Well, thanks again, Dr. Katie.
Yeah, thank you.